Hi, guys. I'm the psychiatric MDS nurse, and I'm here today with a little bit of an unpopular topic. So bear with me, and thank you for joining me today to listen to this topic. Now, you may be ready to roll your eyes at me for talking about this subject, but it's something that's required of us. We're required to at least document on gradual dose reduction attempts. And also, it is for the benefit of our residents. It reduces their risk of adverse events, and reducing medication slowly ensures that they don't have an exacerbation of psychiatric symptoms in the process. So, one of the first things you want to consider is good documentation when you're completing the gradual dose reduction. This is your evidence to surveyors that you've actually done it as required. So, it's required to be done when a resident comes into the facility twice within the first year, with a month in between, and then annually after that, unless contraindicated. You want to develop a plan with a start date and have supportive measures in place for the resident. You want to really document really good any symptoms that come up, any behaviors, any complications that come up during the gradual dose reduction. You also want to document if it's contraindicated for the resident to have a gradual dose reduction again in the future. And we'll talk about this more later. To support your resident during a gradual dose reduction, you want to use non-pharmacological interventions to help them when you're taking the medication away or decreasing the dose. So here on this slide are some examples. If we perform a gradual dose reduction and the resident becomes decompensated and has an exacerbation of psychiatric symptoms, then we're doing resident harm. We're doing harm to our patients. So to avoid that, we want good documentation when it's contraindicated. So gradual dose reductions should be done on any psychotropic medication. This includes more than just antipsychotics. This can include antidepressants, anxiolytics, and mood stabilizers. This definition listed here is the definition that is in the state operations manual. So it's what surveyors will use to determine if a gradual dose reduction should have been done by your facility. The MDS nurse then will review the documentation and code the presence of any gradual dose reductions or contraindications in Section N of the MDS, and they will then help the facility to plan for future gradual dose reductions and documentation. So a resident may have behaviors or a slight increase in symptoms. As long as those can be managed by non-pharmacological interventions, the gradual dose reduction is still a success. The only time they're contraindicated is when the resident is really decompensating during the gradual dose reduction. So thanks, guys, for listening, and feel free to send me comments.